Good evening, folks. This is Dee for your own discussion. D deals with senior care, specifically in a facility and quality of care they receive and things that you have to make sure that they have, like safety concerns and engagement. Okay, so we're going to go through that tonight for discussion D. So please join me in tonight's presentation D, senior care. Okay, rising costs. The cost of senior care has seen a significant rise over the past 2 decades. For instance, the average cost for a private room in a nursing home has nearly doubled since 2024. Okay. Quality of care. Despite the rising costs, there have been numerous reports highlighting gaps in the quality of care provided in senior facilities. Basic needs like assistance with daily activities and safety concerns are often imminent. Okay, safety concerns. Incidents of wandering, excessive bed sores, and unsupervised falls. And medication errors have been reported, leading to severe injuries or even facilities among seniors, fatalities among seniors in care facilities. Folks, it does happen around, in the US. It happens, but places like to cover those things up. People like myself who are advocates for senior care, we go in when we are called in for those kind of deals, and we make sure that our clients get the right kind of care. Just like they need to have a certain family member come in, periodically, and make sure your family, your loved one, is getting the proper care. And it's their right as residents to say something if they're not getting the right kind of care. There are people at facilities called ombudsmen. Those folks are there for residents to make concerns known to. The ombudsman is supposed to be the state's representative in facilities for residents to go to with issues. Then people like me who, when I used to do nursing home transition, I used to go see people weekly until I got them out for issues to make sure that they were getting the right kind of care. That matters to folks. Okay, so we're at safety concerns. We went through those. Now it's in the next one down is engagement. It's crucial for family members to stay engaged in their loved one's care to ensure they're receiving the promised quality, regular visits, communication with staff, and being informed about the facility's practices can make a difference. Like I said, um, just because you put a loved one in a nursing home doesn't mean you shut them away. You have to go and see them and include them in holidays and things and get them out on day visits. Get them out for day visits on a regular basis so that they feel included on people in so they feel like they're still part of the family. But you also have to hold the facility accountable for things that happen in there. Is their right as a resident to have the quality of care they're promised. If you see something that's going wrong, say something to facility, to the right person in the facility or the director of the facility or the head nurse, somebody that's in charge of administration. They need to know that things are going wrong. If you see it, you need to say it. There's too many times when people fall through the cracks and things. So, you know, tonight's show is just to make sure that people know that there are options out there for people that are in nursing homes to get a hold of. Agencies that come in and make sure that you're getting the proper care. Um, like I said, my job, I loved what I did when I did nursing home transition. That's part of elderly care that I love, and now I'm certified in different areas of elderly care, but I still care about what happens to folks. If I see something, I still say something because I'm obligated to. You know, um just as a common courtesy, you got to make sure that nobody's getting hurt in the process. You know, it's a um it's a common practice in places. It does happen, and when it does happen, people shy away from saying something. You know, it if nobody says anything, nothing gets changed. Policies in nursing homes don't get changed if nobody knows about it. You have to make sure that people are aware of things that are going on. You have to if you have a family member that can't use their voice anymore, like a person with dementia that's in a facility, that you see something going wrong for your family member, you have to say something for them because they can't voice their concerns anymore. Later stages in life for dementia, they lose that ability to voice their concerns. So you as a family member have to voice their concerns for them, and you have to see them on a weekly basis, preferably on a daily basis if you have time to. Um, if they're used to seeing your face, every day, make a point to stop in for maybe an hour or two. That makes their day when they see a family member come in and visit them, bring them special gifts like slippers or nightgowns or blankets, for example. That makes their that makes their day if they get something special from a family member. But me as a elderly specialist, I make sure that people have the right kind of care. I take the time to double check before I leave a facility. Make sure somebody has what they need before I leave. Because too many times I've seen people not get the kind of care they need. And me as a person that is in elderly care, that bothers me. I might be a young person, but the kind of job I do in elderly care, that matters to somebody's life. Like I have somebody's life in my hands when I help them with a situation. So I make sure that the situation is tied up neatly so that it runs right for people. That really matters. It does. And for those folks that are in nursing, uh, being kind to a resident matters. Taking the extra time to do the little small details, the small extras, that matters to a person also. That shows them that you care, not just as a nurse's aide, but as a person. You have to treat people in facilities like they're still people because they are. That kind of goes along with the whole package of things. So I just thought I'd do a show on that tonight for everybody's FYI. For now, Gator Wellness, take care, folks.